there's a fine line between what's best for the patient aesthetically and trying to maintain, like, if, as much being conservative and maintaining as much tooth structure or whatever underneath.
And a lot of functionality. I mean, we've talked about headaches, we've talked about TMJ, you've talked about cervical spines and neck stuff and posture. It's far more than just a pretty smile, isn't it?
Yeah, you know what? I never dreamt that when I became a dentist that these heads are forward of our bodies. They weigh about 10 to 12 pounds. They're like bowling balls. And so just by moving the bite around can take a lot of stress off the central nervous system, relax a lot of this area, because the body works hard to hold our heads up over these bodies.
Okay.
So yeah, so who knew that I was going to be able to relieve muscle tension and take away headaches from people just by looking at their bite.
Hello, everyone, and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And today is no exception. Today we have Dr. David Frey from the Perfect White Smile. He's come all the way from Beverly Hills, and that's a joke. And one other confession, he is my personal dentist. He's actually a world-renowned cosmetic dentist, and we're expanding aesthetics into aesthetic dentistry and cosmetic dentistry. And I've asked David to spend some time with us and bring us up to speed on what can be done to improve the whole peri-oral area, the area around your mouth, to optimize facelifts and all the other things we do in facial aesthetics. So first of all, welcome, David. Thank you for taking time out of your busy schedule and sharing your time with us.
Thank you, Grant. I've been trying to get on the show for a long time. Thanks for having me.
It's wonderful to have you. And I know you had to drive all the way from Beverly Hills to Manhattan Beach. But as it turns out, all the other guests today are coming through LAX. They're all flying in from all over the place. So it turns out you're actually the neighbor who's coming across the street.
That's right. Thank you for having me.
It's my pleasure. So
Beverly Hills is ground zero for aesthetics.
That's true. Absolutely. I'm not arguing that. Okay, before we get into the Perfect White Smile and all the wonderful things you can do, I'd like to first ask you, David, where'd you grow up?
I grew up in Woodland Hills, California.
Uh-huh.
My father was a pharmacist and had a pharmacy nearby.
Uh-huh.
And tragically, he passed away when I was 10. And I think I became a dentist sort of for the reason just to stay close to my dad and to get in the health sciences world. I became a dentist.
Interesting.
I have two older sisters. One's a psychologist and one is a teacher. So we all kind of stayed in that realm of the world.
Uh-huh. And where'd you go to school?
Well, I went to LA City School District, and then I went to UCLA, undergraduate. And then for dental school, I went to a school called University of Pacific, which is actually located in San Francisco. The dental school is in San Francisco.
Okay. I'm familiar with UOP. Okay. And the dental school for UOP is in San Francisco.
Correct.
I heard that before.
Right, yeah.
And when you were at UCLA, you got a bachelor's degree. What was your major?
It was actually economics.
Interesting.
So, yeah, they didn't have a business school there, and I was always sort of like business-minded.
Uh-huh.
And so I ended up as an economics major.
Okay. And from then, did you go directly to dental school?
I did. And UOP is a 3-year dental school.
Okay.
And my birthday's like in August, so I graduated. When I graduated dental school, I was only 24 years old.
Okay.
So then I didn't feel like just going out in the workplace right away, so I ended up doing a year. It's called a residency, a general practice residency, and I did it in the country of Israel. I worked in Jerusalem, and basically I treated underprivileged children and adults for a year before coming back to Los Angeles and setting up a private practice.
Well, that's interesting. I didn't know that.
No.
And then when did you get into aesthetic dentistry?
I think in dental school, I always wanted to learn about porcelain veneers. They did not teach it. And so as soon as I got out of dental school, I'm like, how do you learn about porcelain veneers? So there was a lab that claimed they invented the porcelain veneer in Woodland Hills, believe it or not. And I would go and frequent that lab almost on a regular basis, bugging the lab technicians. And so because I was...
And you were already a dentist.
I was already a dentist. And, I was passionate about porcelain veneers, and that was sort of the beginning of my journey with cosmetics.
And so, so you start with porcelain veneers, and
Correct.
then tell me how that transitioned to the other things, from dental implants and the various other things.
Yeah.
You had.
So when I was in dental school, the doctors look in all of our mouths. So they look in my mouth. I had these big, huge silver fillings in my teeth.
Yes.
And I said I wanted to replace those with a white filling. And they said, well, they're too large. You're going to need a crown. So I decided to do nothing and wait. And so when the materials came out, the white materials came out where they can actually bond into the tooth structure, which is the same as a porcelain veneer, which is sort of like a flat restoration. It's like a pancake.
Okay.
But these are just in the form of a filling. I went ahead. I wanted to learn how to do that. So I was like one of the first in line to learn how to bond to the inner structure of tooth structure, which they didn't know how to do when I got out of dental school in the early 90s, or they were just figuring it out. It's called dentin. They only knew how to bond to enamel in the 80s, but not the deeper tooth structure.
Really?
Right. So that's...
Is this a liquid, or is this a paste? The actual white stuff?
Oh, the white? No, it's porcelain, but it's bonded on with a resin, like between the porcelain, which is like glass, and the tooth structure.
Okay.
It's basically really healthy because there's no chemicals involved. It's all done through what we call a mechanical lock. It's like Velcro. It's like two rough surfaces come together on a microscopic level.
Is that when you put those lights in my mouth?
Yeah, exactly. We're curing the resin. So the resin gets caught up in between the rough surfaces and hardens, like crystallizes everywhere. And it's microscopic, so the bond strength is incredible. And what they've done with the bond strength over the last 20, 30 years in dentistry is increased it from what they call megapascal, whatever that is like from 10 to 35, it's gone to an incredible level of strength.
So let's go back to aesthetics. So obviously you can take the silver stuff out and you can put in white stuff, but how do we make the teeth wider and straighter and all that stuff?
So with veneers, you can basically reshape the teeth to allow these little delicate porcelain, little pancake type glass overshays that go over. So if a tooth is out a little further, we bring it in. If a tooth is in, we barely touch it, and we allow the porcelain to come out to bring it out.
Okay.
So usually I look up on a smile, like as a U shape.
Yes.
And I'll say, here's a perfect U. What's in or outside that U? So if you're out, I'll just bring it in a little bit. If you're in, I'll make sure it's going to look like it's perfectly in alignment, so that the veneers, when they all come in, they all have that nice, beautiful arch form, nice, smooth.
Okay.
Right.
Now that's veneers.
Those are porcelain veneers.
Now what's another option besides veneers?
So what happened was, after the 90s, maybe the early 2000s, we realized these materials are so phenomenal and they last a long time and they work really well that they don't need to just be aesthetic. They can actually be on the biting table, and you can actually change a bite with them and not have metal in your mouth at all. So it would just be porcelain and then bonded right to your tooth. So what I was doing was, people with really bad bites, I was helping their bites get into a more corrective, a more idealistic bite position. Okay. And that's where the facial beauty starts to come out. Because once you start proportionalizing someone's face, like from here to here, and we all know the golden proportions.
Yes.
So you want your bite to be in a position where the muscles are very relaxed and calm, and the joint isn't popping or clicking. Everything's like in a working order. And so the bite needs to be somewhat in synergy or balance with the muscles and the joint. So just straightening teeth and making them nice and beautifully straight, but not really in function, is half of the cosmetics that we were able to obtain. So, it's incredible what happens to someone's face when they're actually in we would say a physiologic correct or neuromuscularly correct bite position. They look younger, their faces, they smile better, face looks more relaxed. It's really an incredible transformation.
How do you assess such a thing?
So it's kind of easy, because it's like the horse whisperer. I'm the tooth whisperer.
Okay.
If you look at the teeth on patients, you'll see where they've been wearing their teeth down over the years. And that's sort of where the muscles have been trying to go. So what we do is we take the models of the patient's teeth and we line them up with the wear facets of where they've been wearing their teeth down.
Okay.
And we somewhat open it a little bit to what we would call a nice golden vertical relationship. And then we test it with actually like muscle data. We'll put sensors around the face, like EMG sensors on the muscles. And then we make sure they're nice and calm, low activity. And that's where we kind of place the bite position. We usually try it out first and make sure the patient likes it. And the typical response from a patient is, oh my God, I don't feel the tension in my neck, or I feel like a lot more relaxed in the face. So we'll get those right away when we put these new bite positions in for patients prior to doing the cosmetics. So it's sort of like the foundation.
Okay.
We're laying a better foundation for the cosmetics to go through.
So it's functional and aesthetic. You mentioned TMJ and you mentioned popping. Can you stop TMJ issues?
Yeah, we stop it all day long. And it's really incredible because in the early 2000s, when we were moving the bites around, people would tell me, you know what, I used to get chronic headaches and I noticed that I haven't had one in a long time. Or my neck pain that I've been living with is somewhat gone. And so I was realizing that by improving these bites, I was also helping a lot of patients who had TMJ. And a lot of people don't even know they have TMJ. They think their headaches are caused by other things that can't be corrected by lining up the jaw with the spine and the muscles and everything. And so we try everything out first. We do it with we call it phase one, but we try it out to see if the patient likes it. So we'll reline the bite and we'll have them wear not the porcelain one, but like a preliminary one.
Like fake ones?
Yeah, fake one. We call it a trial bite.
Really?
And we'll put it in and let the patient go for a couple of weeks or a month or whatever. And they say, it's no big deal. It feels like my regular teeth. And they eat meals with it. And then we know we can restore in that position safely.
Okay. Where do dental implants come in?
Yeah, so, I call it I wrote this book, The Physiologic Dentist, and basically we look at like a dental pie. And in the dental pie, there's all these pieces of pie, like red. I call them either red piece or a green piece. Okay. So one of them would be missing teeth. If you have missing teeth,
yes.
So where would that go in the planning of your new smile? So I try to get that green pie all green, sort of like the green light in Hollywood. Before we proceed to do your gorgeous new smile, I have to make sure everything's in order. So if you're missing teeth, the patient has the option of getting a dental implant or maybe a bridge if they have teeth behind it. If they don't have teeth behind it and they need that tooth there to support their jaw and their facial structure, then they have to have an implant in order to do that if they want something fixed that doesn't come out. So we would start that process prior to me actually doing the porcelain veneers and the smile makeover.
Okay.
It's sort of like the foundation. We want to just lay it all down and get it all perfect before I go in and do my work.
Implants come in for missing teeth.
Correct.
Where else might an aesthetic patient, opt for an implant? Are there other instances besides a missing tooth?
We call them dental cripples, like people that their teeth are just horrendous. They may be suffering from severe periodontal disease where the bone's going away, and they've tried so hard throughout their lifetime to maintain their teeth, and they can't seem to afford to keep doing something. As soon as they pay for one thing, another thing breaks. And so the recommendation is to take all your teeth out, even if they're all failing, just remove them all. And we can place implants in the same day. It's really remarkable because it's all done digitally. We take 3D scanners of the teeth and the jaws, and we superimpose that with a 3D CAT scan. And these labs will design everything on a computer and give it to us. and it's all done. And it's like, seriously, the surgery runs so smooth for those cases, and they're so complex, but with great planning, it's like a super smooth procedure.
So that's an end-line dental cripple, right?
Yeah.
But how about,
So
let's take someone who has a facelift, they're planning on a facelift or other facial aesthetic procedures, and their teeth don't look that great, or they're obviously the proportions are wrong.
Correct.
And we notice this all the time as we're aesthetic plastic surgeons. Obviously, people don't just look at their neck and their jowls and their cheeks and so forth, but their teeth and their mouths are right there in front. If we can do the best facelift in the world, but if their teeth look like snaggly puss or something, it's not going to work. So where do you come in there? And also timing-wise, what's the best for you? What's the best for the patient? Is there I think ideal timing?
I mean, I think it's really up to the patient to know like when they'd want to do it. But I think like if someone does have a collapsed bite where the vertical dimension is very decreased in this area here,
okay,
it's probably smart to let the dentist at least raise the bite. Doesn't have to do the smile at that point, but it's quick. Once we have that green light, so to speak,
okay,
it's 2 visits, and those two, one to prep the teeth for the veneers, and the next to bond them in. So, and there's a time span usually between 1 to 3 weeks between that time span when the lab can return everything to us. So we need these 2 major visits, one to prep and one to install the new smile. But they wear a temporary beautiful smile in the meantime. So if they're getting a facelift, my only thinking is that I may be helping the muscles a little bit relax, and I know the plastic surgeons are moving skin around.
And sometimes deeper tissues than skin.
Than muscle, So we find a place of least electrical activity on an EMG sensor. So if we put an EMG sensor on the muscle, we're looking for low activity. And so we can bring it into a position of low activity. I mean, I just had a patient come to me from a plastic surgeon, and they were thinking of doing a chin implant. His jaw was set back like this, a lot of vertical, what's called overjet.
Okay.
And all we do is we just take the lower jaw and we move it forward, all the way forward. There's going to be a big gap between the back teeth and the upper back teeth.
Sure.
And we build that up with teeth. So with porcelain or teeth, I just built it right up. Have him live with that new bite with his jaw all the way forward. And that's why I have a picture of it in this book if you want to see.
I would love to see it.
But people look like they're like a soldier almost, like they look super healthy. So like, let me just show you this one picture, Grant, that I.
So while you're looking for it, when we do sliding genioplasties, or we actually make a cut in the jawbone or mandible called an osteotomy, and we slide the chin forward for a deficient chin, that accomplishes similar things you're talking about, but not with the teeth. Do you work in conjunction with the plastic surgeon if they want to do a genioplasty or even a chin implant?
No, So some of them come up to use my CAT scan because I have a full head CAT scan, and they come up and they look at it before doing a genioplasty. Is that what you're saying?
Yeah.
Right.
Okay. So show me what you've got
so I'm
here.
just showing you like the difference in this man's profile.
Oh yeah, that's.
And that's just moving the lower jaw forward.
Now, does that affect his TMJ?
Yeah, in a positive way, because
it's not pulling it out of joint, like subluxing it.
No, you're still staying in the fossa. It's just coming down like this, but you're still in that. You're still in that fossa. It's not subluxated at all. So yeah.
Here you go. Before and after, you can see the difference in his jawline there.
That's
remarkable,
and
that's done just with teeth.
Just with teeth.
So anyone has any questions about the aesthetics of what you're doing right there, that looks like a sliding genioplasty, and even his neck looks better.
Yeah, because it fixes posture, and there's a lot of studies that say that the bite and the posture in your neck is related. So if you draw a straight line straight through the bite, you're going to end up at around C2, in between C2 and C1.
Okay.
And so if your bite's like this, your bite's like not level, and we level it, we're helping this whole postural area in the neck. So, and there's studies that confirm that.
Interesting.
But every dentist knows.
They do?
Every dentist knows that when we move here, we're affecting posture, because we can see improved posture when we go ahead and reline someone's bite into a better location.
Okay, so we've gone through veneers, we've talked about vertical height, we've talked about the implants, we've talked about putting this porcelain on top of the tooth, but we haven't talked about teeth straightening. And that's clearly a part of dental aesthetics. Do you do any teeth straightening?
So Invisalign, we do Invisalign.
Okay.
We also do full-blown braces, because I do this technique with, it's sort of like a TMJ type of orthodontics, where we actually move the teeth into a really healthy place instead of just by looking at muscles and the joint and not ignoring that. I think what happens is a lot of people just make the teeth straight, but the whole jaw position is not in its ideal place.
Do you make it straight first and then do all this aesthetic stuff that you do, or do you do this?
We try to do it in combo.
Oh, okay.
But just straightening teeth, like a lot of patients just, have little teeth that are like, they're not perfect. One's out, one's in, like you're saying, or they're little spacing or gaps. Invisalign works tremendously for stuff like that, just to help improve the smile.
Have you ever used Embrace?
Embrace? No.
We had Brent Hauser on the show here, who's the VP of Sales, and Clint Carnell also, who is the CEO of Embrace. And they have a wire on the inside of the teeth, and it's proprietary alloy and proprietary wire technology. And unlike Invisalign, it's not like a retainer or a mouth guard. Also, another company we've worked with is a ULab, which also has a sort of it's kind of like
clear aligner.
Clear aligner, yeah. But it's made in the doctor's office. But typically, I'm just curious: is it, if you had your choice, do you typically straighten the teeth first and then do what you do? I know you said ideally they're together.
So what you do is you look at someone's bite and see if it's straight across. Like if you bring the lower jaw forward, is it still straight? Sometimes patients' teeth will drop down, and there'll be like a drop down. They call that a curve of spee. That's not good.
Okay.
And so those teeth need to be lifted up, like they didn't erupt all the way up, like during the time that their teeth came. It's much more difficult to do stuff like that with Invisalign than it is with just traditional braces.
Okay.
To move like what we call vertical dimension up.
I bet.
And that's a lot of times what the patient needs to get that perfect facial aesthetic.
So do you put braces on them and pull them down or pull them up?
Yeah, so it's insane, but when the braces, it's not like pulling up or down. The whole architecture of the bone completely drifts up, meaning like the tooth in the gum, in the bone, everything just sort of like comes up and meets itself. It's really super remarkable. Yeah, just like, a child when their teeth are coming in, they kind of like to find each other, the teeth, and they just kind of keep erupting, but they don't erupt like out of the bone. They erupt with the gum and the whole bone structure.
Sure.
So it's really incredible. The ortho technique that I learned does that exact same thing, and it just allows for them to re-erupt like normal teeth. So.
Okay, well, as long as we're on aesthetic dentistry, what about teeth whitening?
Yeah, teeth whitening is fantastic. So we do a zoom. We always did the zoom whitening, which is like it's a light that goes on your teeth with a gel, and you sit there for like 30-40 minutes. It's like a tanning salon. And
a tanning salon for your teeth.
Yeah, we do trays and whitening. We like to do them both. So I call it like the wow factor. You go under a light. It's like a salon. You go under a light. You look at your teeth when you're done, and it's remarkably whiter. And you say to yourself, wow, that's incredible. But what happens is it doesn't last. It's slowly, like a tan, slowly starts to fade away. So you want to take some trays and take some gel home. And when you start noticing it out of that wow factor, you can just put it in for an hour or two, and it brings it back up. the whitening.
And the patient can do that at home?
They can do that at home with trays. They're called trays.
Okay.
Even the Crest white strips work. They have carbonide peroxide. It's like the main ingredient to whiten teeth.
And will that whiten porcelain teeth or only natural teeth?
Porcelain teeth, whatever color you choose, that will be your color indefinitely. There's only two types of stains, extrinsic or intrinsic. So when we say an extrinsic stain, that can just be cleaned off. So you might get like a coffee stain
I was going to say,
on your
what about
teeth.
coffee or wine?
Yeah, and it's just you go to the dentist and they can, if it's not coming off with your toothbrush, it would come off in our dental office.
Okay.
Under like some of our instruments that we have. And then intrinsic stain would be like the tooth changed color, like turn from white to yellow.
Okay.
And that's not going to happen with a porcelain veneer, but it can happen in your natural teeth.
But what if your porcelain veneer gets stained with coffee?
Yeah, so that's an
wine?
extrinsic, so that can be cleaned off.
Can you wear a whitening strip and make it better?
No, it's not going to whiten.
No, you have to take it off.
No, they're non-porous. They're never going to turn. They're never going to stain. It's like, you know how they pull porcelain plates out of the ocean that have been sitting in a shipwreck for 700 years?
I must say I don't.
And they sit in a museum. I mean, they're non-porous. You can clean them and get them back to their natural beauty. They're not going to stain. They're never going to turn color. What can turn color is your teeth underneath the veneer, and the veneers are really thin. So like if your teeth got really, really yellow underneath the porcelain veneer would still stay white, but it may not have as much of that whiteness. It may have more warmth, we call it, warmth, under the porcelain.
Because it's brown underneath?
Yeah, because it's brown underneath. But the thinner the veneer, the more of your tooth is going to show.
Sure.
The thicker the veneer, the more color the porcelain veneer will hold.
Makes sense.
Yeah, so we try to be as conservative as possible, but there's a fine line between what's best for the patient aesthetically and trying to maintain, like, if, you know, as much being conservative and maintain as much tooth structure or whatever underneath.
And a lot of functionality. I mean, we've talked about headaches, we've talked about TMJ, you've talked about cervical spines and neck stuff and posture. It's far more than just a pretty smile, isn't it?
Yeah, you know what? I never dreamt that when I became a dentist that these heads are forward of our bodies. They weigh about 10 to 12 pounds. They're like bowling balls. And so just by moving the bite around can take a lot of stress off the central nervous system, relax a lot of this area, because the body works hard to hold our heads up over these bodies.
Okay.
So yeah, so who knew that I was going to be able to relieve muscle tension and take away headaches from people just by looking at their bite and seeing that they're in a strong imbalance.
It's remarkable. Those of us not in the dental field don't think of it that way. I mean, it's just so novel to me hearing all these other things that you're doing and the effects it has on overall health.
It sure does. It sure does.
Yeah.
Yeah, so I also do it for athletes. And I do a sports mouth guard that I have on the side. It's called the Zone Mouth Guard.
Okay.
But when we change a bite into this optimum position, I can help, like I say, helping the weak or the people that need the help. You know, they're suffering from headaches. That would be the TMJ patients.
Right.
But it also helps us super strong. So like if you're super strong and then you align your bite into these more physiologic correct bite alignments, you get better athletic performance, more flexibility, more strength, and better balance.
Who wouldn't want that? Oops.
Yeah, who wouldn't want that? So
who wouldn't want that?
Yeah, so it's just by aligning the bite a little bit can help both ways. Can help anybody with the workout down to.
So could it help my golf swing?
Yeah, it can help your golf swing for sure. So that's what it's called, Performance Mouthpiece. And it's a mouthpiece that actually just will take your jaw, move it out into this physiologic correct position. You can feel the strength, increase in strength.
And where can a person get that?
At zonemouthguard.com.
Really?
Yeah.
Zone.
Zone, yeah. Because it gets you in the zone.
I get it.
Right.
Fascinating. Well, what do you see in the future? If you look forward in your crystal ball there and you think, oh, what's new? I mean, you've already told me that you're doing things you didn't learn in dental school by far, and things that weren't even around 10 years ago. 20 years ago, you didn't even have porcelain the way you're describing it, and a bonding. I mean, it's unbelievable to me how much has changed in 20 years. I'm sitting here.
No, I
so
think,
what's going to happen? What's the future?
Well, the future is definitely in with computers and 3D
and AI.
And AI. Yeah, AI, is great for diagnosing CAT scans and our X-rays.
Yeah.
So it'll take a lot of the guesswork out of us diagnosing. Or it finds the problem and then asks us right now, is this a problem? Yes or no? And then we just hit yes or whatever. And the computer keeps getting smarter and smarter of diagnosing these.
Are the computers going to replace the dentist?
I mean, maybe they're doing some robotic stuff where, it drills a filling for you and that kind of thing. So I think it may happen eventually. But still, I think that's far away. But I think like I said, superimposing the CAT scans on top of 3D images, and then they actually make you stents and stuff to place an implant. They do them what's called guided. So they give you a stent and on a CAT scan, looking at the implant placed right up to the sinus wall without going through it or without penetrating, with exact precision, because it's all done through these little stents, and all the dentist does is drill through a hole to the exact preset size. He doesn't have to think. He doesn't have to hold a steady hand.
That's amazing.
Yeah, and that's all done with computers. So for sure, that kind of thing. But smile design and knowing different smiles, still a human touch.
Yeah, sure.
For that. Some people like a round smile. Some people like more squared. And there's different smile designs.
Do you think that dentists, doctors like you, will be working in plastic surgery offices, or said the other way, plastic surgery offices were working with you, such that a plastic surgeon and a dentist, aesthetic cosmetic dentist like yourself, will literally have the same physical office?
I mean, I tried, how you and I are free thinkers.
Yeah.
And when you were practicing, I always tried to get you, hey, Grant, can I come and work alongside, maybe in the operatory, let's put a dental thing in there. Let me come in, prep the teeth, the same time all this stuff's going on, or and somehow work as a team together to get the optimum aesthetics that are needed for a patient. Whether you do your surgery and then we do our surgery, and how you break that up, it can go either way. I was saying,
right.
But I think it's fantastic because like that one plastic surgeon, I said, well, look at his bite. Don't do a chin implant here. Let me just move the jaw forward and let's see what he thinks there about that. So if you look in the mouth, you can see a lot.
Yeah, I can absolutely see the day coming when a plastic surgeon, aesthetic plastic surgeon, and aesthetic dentist would be working side by side for optimum experience for the patient.
I mean, I think we would love it. As dentists, we would love it. I kind of feel like, as a dentist, I've been a dentist 34 years, but we kind of feel like we're part of the medical community.
Sure.
But we're sort of on the outside. So there's always the medical insurance, then you have dental insurance.
Yeah.
We were sort of separated.
Yeah.
And the schools were separated, and our schools were different. And so I always dreamt of the day where we all come together like that. I think it's really well needed from what the doctors learn about dentistry and what the dentists learn about medicine. We've come together.
And certainly in the field of aesthetics and beauty, I can see a natural synergy there, and that might be the way which they come together. I'm sure the dental professors and medical professors will roll over in their graves thinking about it. But because aesthetics is so small compared to the whole field of medicine, But I certainly can see it happening in the years to come. Well, David, I want to thank you so much for being on the show.
Thank you.
We've had a wonderful time.
Absolutely.
And thank you for being my dentist.
Oh, my pleasure. It's more than a pleasure. It's
and
an
my
honor.
mother's and my other family members who I won't identify right now because I don't want them to get upset with me. And you've also taken care of so many of my patients over the years.
Oh, my God, yes.
And you've optimized so many of my patients, and that's how I
Thank
got
you.
to know you and see your incredible work. And his office is in Beverly Hills. also, if you're in the London area, he has another office in London.
Which is true.
Yes,
Yeah,
I know.
on Harley Street, yes.
So, well, give my very best to your lovely wife, Stephanie, and your
Thank
children.
you. Likewise to
And
you.
absolutely. Take
Thank
care.
you. Thank you, Grant.
You're very
Appreciate
welcome.
being on
Thank
the
you.
show.
And thank you all for joining us on this latest episode of The Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And as you saw, today was no exception. We'll see you every Tuesday on The Technology of Beauty. Take care.